We have been getting so many calls from different patients asking us about anesthetics, the types that we use in our office, and if they contain graphene oxide, and want to know what we are doing as a biological dental office to address this issue. So if this topic is something that you've heard about, there's so much misinformation out there about anesthetics. And I think it's a really great podcast if you want to learn more about where we actually are with the science and what we know is fact, and what we don't know is fact. Welcome back to another episode of Your Mouth Matters. I'm Dr. Rebecca Taylor, owner of Green City Dental, a holistic and biological dental office in Edmonds, Washington, and Otodontics, a practice that focuses on TMJ, snoring and sleep apnea, and functional orthodontics. I have to be honest that today's topic I don't know a ton about, which is why I have a very special guest on the show, Dr. Teresa Scott and Dr. Isabel Perez. We are going to dive deep into a topic that we've been getting a lot of phone calls about recently, which is anesthetics. And there's a lot of talk right now about the graphene that's been found in a couple of anesthetics and how that could potentially be impacting our health. So welcome, ladies. Welcome on the show. Thank you guys for being here.
Thank you for having me.
Thank you for having us.
So I know that the front office has been getting a lot of phone calls about anesthetics and graphene, and there's a lot of people online talking about this topic. So, and like I said, I don't know a ton about this topic. So can one of you just kind of talk a little bit about what graphene is and, why we're finding it in anesthetics?
I'm going to let Isabel do it. Clearly, you are very well informed, so go for it.
Well, they're talking a lot more about this graphene oxide that has been found on anesthetics, but actually they have been using it for a while. And it's not only used in anesthetics, it's also they're adding it on insulin, for example, a lot of injectable medications. They're adding it in food. They're adding it in baby formula. Some of the reasons why they say they add this is because it can have an antibacterial effect. But then the researchers have been studying the side effects of this graphene oxide and what is doing with the blood of the patients. I actually did a study with a doctor, a naturopathic doctor, where we got some blood samples from different people. And then we found under the dark field microscopy these particles that were not normal in a body's blood. So like you normally find white blood cells, red blood cells. And this artifact that we saw we didn't know what it was. But then when we started researching more about it, it was actually the graphene oxide that looks like a filament, like a fiber filament. And then what it was doing is it was actually the white cells, the white blood cells, which are the army of the body. They were trying to attack this filament. And then the red blood cells were kind of creating something that is called rouleau. So they were attaching together. And then what they have found is that it creates kind of like makes the blood more stagnant, more sticky. And they're attributing this to a lot of cases of cardiovascular disease, more arrhythmias, strokes, lung problems. There is a lot of consequences. And then we have found that they're adding it in our anesthetic. So that's why patients are concerned that we're injecting them with this graphene oxide.
Wow. Okay. So they're using the graphene oxide to help get the anesthetic deeper into the tissue, or like so they're doing it because they want the anesthetic to last longer, or what's the why?
That was one of their ideas. And because it also it kind of prolongs the effects of the local anesthetic by creating this little filament. So it stays in the area, in that local area longer. So it kind of has a prolonged release of the anesthetic.
Okay. And you said that they're adding it into like even like formula for babies and food and everything. And what's the purpose of that?
I didn't get into the research on that one, but I know they're adding it to multiple things.
So I have a question when I was hearing you say that, and please correct me if I'm wrong, but the concern in working on patients and giving them the local anesthetic, and I understand Exparel and ropivacaine, those were designed to last 3 days. But I'm talking using plain old, the plain anesthetics or Setonest plain or Setonest forte or articaine, which is Septicaine or Orablock, right? So if those claims were to be proven in saying that it's causing blood to clot sooner, which is, you're saying it's thick and sticky. So I'm going to tell you from practical experience what I've noticed in the last 4 years with my extractions, right, was that 4 years ago when we did our PRF, the PRF went like clockwork. It did not have any issues. But what I'm noticing now, and what most of our biological colleagues are noticing, is that when we're doing PRF, it takes 2, 3, 4 times longer to clot, for that platelet-rich fibrin to create a plug. That's like a huge amount more time, not less. That's what we've noticed. So if I were to say anything about, and I don't know when they started adding graphene oxide to the local anesthetics, I will tell you, Septicaine and all of the other normal anesthetics that are not Exparel or ropivacaine, they don't last any longer now than they did before. I get the same amount of time of anesthetic, right? So it's not making it last longer. Mm-hmm. That's number one. And number two, the clotting has taken so much longer now than it was 4 years ago. And so both of those would seem to refute, I guess, to a degree, the claim that, now it's possible. I 100% agree that it's possible because, that there's graphene oxide in there. But if people are thinking it's one of those two reasons, I can tell you just from practical experience, anesthetic isn't lasting any longer than it was 4 years ago. It's not lasting. It's not shorter either. It's about the same amount of time. Mm-hmm. And the clotting thing, that I'm noticing in practicality. And Isabel, you were nodding your head too, which tells me that you've been noticing the same trend when you're doing PRF on your patients. Mm-hmm. I used to not draw the blood until after I pulled the tooth because it went so quickly. We draw the blood while the patient is getting numb now.
Wow.
Because it takes so much longer to get a clot.
Wow.
Yes, I agree. But, it's something that is relatively new. There's just starting to do research about this. I don't think that the graphene oxide is being added recently. I think it has been added for a while already. And then the changes that we're seeing, because I am seeing exactly the same thing, my PRF, which is the platelet-rich fibrin, what we put after we remove a tooth to help the patient heal better, is taking a lot longer. And I'm seeing that the fibrin is not developed right away. I need to open it to get some oxygen to be able for it to form. So then this is all hypotheses, right? Because there is not a lot of research that is happening. They're just starting to do research about it. And to be able to have a valid research and information, they need to do several testing on several anesthetics, several patients, and under the same conditions to be able to be reliable. I'm thinking also that the immune system has changed significantly in our patients recently. And it could be, I don't know, again, another hypothesis. It could be after COVID. And there's a lot of things that are happening in the patient's immune system. So I'm seeing a lot of cases of high cholesterol in patients that used to be completely normal, and that can affect the results of the PRF. Then patients with high triglycerides, very low vitamin D levels, all these different things that are not causing a good response from the body. And then we were getting these samples or the blood from the patients, and the PRF is not okay. So yes, it could be not just the anesthetics, it could be the vaccines, it could be the things that are adding in the food, or it could be also a consequence of COVID and a lower immune system. So it's still pretty early to tell the truth about, is it graphene oxide causing all this, or is it something else?
Mm-hmm. Exactly.
So who is the one who discovered that there was graphene in anesthetic? Because is it on the label? Like when you...
No,
it's not on the label. Okay, so somebody figured out, oh, there's graphene oxide in my anesthetic, right?
Yes, and it started when with COVID, right? Because they started doing a lot of testing in blood, and then they started seeing things in the blood samples that were not normal. As I was saying, when we did this research and look under the microscope, there were all these images, and you guys can look online and look for graphene oxide under the microscope, and you can see it's like a filament, like a little fibrin, and then they were saying, and then it kind of glows. It has like a little glow with the dark field microscopy. And then the white blood cells attaching to it, trying to kind of attack that. So they started doing more and more research about it. And then they found out, okay, it is also added. Then they discovered that was the graphene oxide. And then, okay, where else can we find this? Or where is it? Why is the people having this in the body, in their blood, where we didn't used to see this before? And then so they had attributed it to the vaccines, to the COVID vaccines. But then, okay, where else can we find it? Maybe it's not from the vaccine. So then they started looking into the food and baby formula, the different injectable medications like insulin. And then, well, they said, well, why not? Let's look into the anesthetic. And that's how they found it. The manufacturers are not saying that they're adding it. There was a report from someone that they were sending information to test the different anesthetics, and a lot of the manufacturers, they were not responding. They were taking a long time to respond. They were being very vague about it. And then some of them, they said, is not intentionally added, not denying that there was some graphene oxide.
So is graphene oxide, is it just like a byproduct of the manufacturing process, or it's kind of like, when you have a patient that says, I want to make sure, there's no fluoride in my composite. And then you call the company because they don't say. And then the company, when I've talked to composite companies, they're like, well, we can't say that there's not fluoride in it because fluoride's in our water. And there could be some in the product because it's in our water, right? So is it like I guess it just seems really odd to me that they wouldn't necessarily be adding it, but intentionally, but then how is it getting into the anesthetic?
Yeah, I have no answer to that, unfortunately, because they're not being very open or clear to talk about it. And as I said, this is something relatively new. So we will find out more about it probably next year.
I'm wondering if they're adding it as a preservative. And the only reason I say that is because if it's supposed to have an antibacterial effect, then potentially it could enhance the life of a product. And if they're putting it in things like baby food and so on and so forth, then I'm guessing they're wanting perishable things to extend their life in some way. That's my theory. I don't know for sure, but that seems reasonable to me more than the clotting thing, but
the clotting was something that was found after the fact. So it's just relatively new because they're studying the side effects with COVID vaccines, right? So it's like something that
it's just all I was saying is that if we were noticing in a trend that things were clotting more, then that would make sense to me. But since the trend has been that all of us are noticing that clotting is decreased, it's negatively altered when we do get goobers, they're smaller, they're not as good a quality, they're weaker, et cetera. And that's what we're noticing. It's not me, it's not you, it's all of us who do this are noticing it across the board, which means we know that regardless of what has happened in the last 4 years, clotting has been weird. People either clot way too much and quickly, or they don't clot well, so it's one or the other. And it's usually they're not clotting well, because the people who clot too much are also the ones who have died because it went thick and ropey in their veins immediately. Those are the ones who have died. So what has survived is potentially something we need to think about as to whether or not, that is why we're seeing such a decrease in the quality and quantity of clotting, but we're not seeing a marked increase in any of our patients. And I'm like, I wonder if it's because when it caused the marked increase, it was immediate and it killed them. Things that make me go,
So Teresa, we were talking before this podcast about how the studies that have been done on anesthetics are limited, and that they actually haven't had a chance to study all of the anesthetics, right?
Correct. And that study, that series of letters that were exchanged, that was all on that one website. And I remember seeing all of the, this doctor wrote to many, we're not talking one or two, many labs asking them to test, and was repeatedly denied. And so then only a single lab said yes, and they really only tested one anesthetic, not multiple brands, multiple lot dates. You see what I'm saying? Like it's not, that's what Isabel was saying. It's like, that's not really scientific.
Yeah.
So the IABDM, when I brought the problem to Dawn Ewing, who's the executive director, I was like, hey, Dawn, people are asking about this in my groups and stuff. What do I tell them? She's like, oh, graphene oxide is in everything. People are worrying about nothing. And, this is what she was telling me. And I'm like, okay, but has it occurred to us to maybe try to find a lab who will fund it? And she was like, oh, look around. And she did. And she found somebody, and I'm thrilled, and so the group of us that were in the board at the IABDM, she sends the notice around, hey, I need samples of anesthetic from different places so that it's like completely random as to who gets what. Send them in to me so I can send them to be tested. So I happen to be in Houston. Dawn's in Houston. I had my assistant march down, 3 carpules of all the different kinds of anesthetic that I've got, as my contribution to the cause. And they sent the tests out. I mean, they sent the kit anesthetics out to the lab in early October. And the last I heard, we're supposed to have the results back sometime in February. I'll be sure to post it just as soon as, post, because I think she said the IABDM will be doing like a Zoom meeting for people to tell, to inform us. So if they do, I'll be there. All my ears on.
Wow. That's going to be a really interesting, that'll be a really interesting thing to see. Because right now, I think it's AuraBlock that's been tested, right?
Correct.
So AuraBlock,
specifically AuraBlock, not Septicane, because they're both articaine.
Yeah. So there's different brands, even though it's the same thing, even though it's Septicane or lidocaine, there could be different brands and it's a slightly different mixture, right? And that's what makes this even more confusing for patients because, they read AuraBlock and they research that and then they research that it's a Septicane and then they come and they're like, you have a Septicane, and then they're like, that has the graphene. And so you're like, okay, but we've only tested one. There's only been one anesthetic tested. And at this point in time, I don't know anybody who would want to go through getting a tooth extracted without being numb.
No.
So,
right.
Right? I mean, I guess if you want to try, but it kind of feels like one of those things where we're kind of stuck, right? Because they're afraid to go to the dentist because the graphene oxide in the anesthetics that could maybe be there, which we don't even know if it is or not, because this was just was it just one carpule that they tested of the Orablock?
So I thought it was only one, and Isabel says that it was more.
Yes, she said that she has been, this doctor said that she has been testing multiple anesthetics. Dr. Ana Maria Mihalcia.
Yeah, Mihalcia or something like that. Yeah.
Yes.
Yeah.
She's a regarded researcher, so she's been doing this for a while. And they do it, like they test it on the 20x, 100x, 200x under the microscopy. And then also they use another technique to find that. Because some of the testing, when they go and look through the microscope, they need to do it correctly. And a lot of people, unfortunately, are doing the testing and they're alarming everybody, saying, oh, yes, there is some of this graphene oxide, but then really, because it looks like a fiber, so it could be just a little fiber from the cloth that they use to clean things with, even though they look a little different, but they need to be done correctly, right? And then the idea of, oh, they have been using this for a long time, don't worry about it. I do not agree with that, because the idea of not knowing something doesn't mean that it's going to cause problems. The same thing when we first started talking about HIV patients. We didn't know a lot about it. And then they were saying to us when I was studying, is like, treat everybody as if they were an HIV patient, because we were not really knowledgeable about it. So this is not comparing, it's not the same to compare it, but it's like, we need to be aware that there is something that they have found that it can be harmful for the body. So we need to start treating this situation as something that can be harmful for not only our patients, but for us as well. Because if they're putting it everywhere, we might all have some graphene oxide in our body, right? Just like heavy metals.
Yeah, I mean, it's the same with fluoride, right? You're like... But I will tell you, if I go out to eat and I'm thirsty, I'm going to drink the fluoride water.
Exactly.
I mean, I think at some point you have to decide how neurotic you want to be, because to me, I would like to still live my life too and not live in a bubble,
Yes.
I already feel like I'm in such a bubble, being a biological dentist.
I'll tell you right now. Yeah, I'll tell you right now, though, when Dawn said, don't worry about it, I think that's kind of what she was like, that she's like, yeah, just, live. Don't live in fear. We live on this planet, and it's true. We live here, we function, and we don't live, none of us lives out in the woods, not surrounded. We're surrounded by technology. We're surrounded by chemicals, etc. So, how paranoid are we going to be, and how much of my time am I going to spend, in complete abject misery and anxiety, or am I going to choose to go out there and just live, try to make better food choices, try to make, better choices in terms of all those things, but not drive myself crazy either. I'm going to go on vacation. We're going to go in an airplane. Yeah. We're going to be exposed to radiation up in the atmosphere, because I will fly.
Yeah.
You know what I mean? and it's like that with everything. I'm going to have my cell phone. I'm going to have, I don't generally use AirPods or whatever, but I don't have a place to put earphones. So I've got these on now. I'm not going to worry about it for the short amount of time that I'm on here.
Yeah.
Does that make sense?
Yeah, I think
I try not to live in fear anymore. I'm done living in fear.
I think that is such a powerful thing to say, and I completely 100% agree with you. I think it's important to be conscious. It's important to, make the best choices that you can in the moment. But when you get so hung up about something, it actually, I think, can do more damage. For example, if a patient comes in and they have a big abscess on their tooth, like a big abscess, and they do not want to do anesthetic, and so therefore they are not going to get this tooth removed. To me, that is so much more damaging to their systemic health than just having the graphene oxide in the anesthetic and getting that tooth out, right? You always have to weigh the risks and the benefits, and there's always pros and cons, right? Nothing ever comes without a side effect. So you have to decide, like, okay, I'm weighing this out, and what's actually going to be better for me. And I think sometimes people get so extreme, and there's so much fear around things that they actually don't pursue treatments that they really need to do, and that hurts them more.
Yeah, I agree. I agree with that. And also there are things that can be done to help get rid of that, or at least detox. Just the same thing with heavy metals or like mercury, for example. Even with graphene oxide, there are things that you can do. So they're saying that, for example, NAC, glutathione, using melatonin, milk thistle, quercetin, those are things that can help remove that graphene oxide. Vitamin C, vitamin D3. So those are things that
basically boost your immune system.
Exactly.
And do all the things that you would for mercury detox.
Exactly.
Yeah, pretty much is what it's, that's all we really can do at this point, Isabel. Think about it, because this is still being newly studied. So the very best we can do is essentially treat it as we do any other toxin. We're going to be taking supplementation that's appropriate and adequate. We're going to be, making sure that we eat clean. We're going to, all of the things that we would be doing to regain our health from literally any other inflammatory process. That's what we can do here. So rather than drive ourselves crazy, just you live a clean life, but don't drive yourself insane. You need your sanity.
Yeah. So I know that we have had a lot of patients call about this topic. And Isabel, you have done a lot of research, obviously way more than I have on this topic. And there are some things that your dentist can do to potentially remove that graphene oxide right from the anesthetic. So Isabel, I'll let you talk about that because I don't know much about it. But we do, I think one of the things that I love about Dr. Isabel and just our practice is that we're always pushing, we're always trying to find, solutions, and we listen to our patients, when they call and ask questions about these things, instead of writing them off and saying, oh, I can't believe, that's such a crazy thing and we don't care. We're like, we need to research that. Let's go find more about that. And then maybe there is a solution. So why don't you talk about what we do in our office, Isabel?
So when we started receiving these phone calls from patients, is like, oh my gosh, what are we going to do? And there are some scientists and some researchers in Europe that they have done things, and I saw someone, I think it was from Spain, where he used a magnet and he had to move the magnet like 3 times on the carpule before injecting the patient. And I was like, I was picturing myself doing this. It's like, wow, this is going to be interesting to do this multiple times. And I didn't know how accurate that was. And I went in the rabbit hole and found this scientist. He's a researcher from Argentina. And I saw these other 2 dentists that they go and do testing in the lab. And they found that this device, so he created this device, it's called the Odontox from Argentina. And what it does is it's just with electromagnetic resonance and then also a magnet. We need to agitate the anesthetic and put it kind of upside down in this device. And then we press a button, activates this electromagnetic resonance frequency that sends a range between 0.2 hertz to 100 kilohertz. And then that filters the graphene oxide and also aluminum, for example, because there is also aluminum in anesthetics. And as we have talked before, we do not want any metals, any heavy metals in our body. We don't want any of that is going to react, is not biocompatible. So then what we need to do is we put it in there, we put the anesthetic in there, and it creates this electromagnetic resonance, separates the graphene oxide, sends it to the opposite side when we're going to inject the patient. And we are supposed to leave about 1/3 of the anesthetic, which is the one that contains the graphene oxide. So we are injecting the anesthetic without the graphene oxide or aluminum.
Or a cleaner anesthetic injection.
Correct.
And have you noticed any difference in clotting or PRF or anything like that?
It's too soon to tell because we just got the device about 3 weeks ago or something like that. So it's very difficult to notice that. I haven't noticed anything with the PRF. And I don't think that we will notice it because it's something that it takes time and is going to be in the system. And I guess depending on the amount of the graphene oxide, you're going to notice things like that.
Yeah, I mean, if it's in food and all these other things, then, the dental anesthetic is probably a tiny little sliver of your source of it, right? So
correct, yes.
That's interesting.
Yes.
Well, it'll be so interesting, Teresa, to get the information back from your lab and all those different anesthetics.
I'm looking forward to it.
Yeah, I'm really looking forward to seeing that. And then it'll just be interesting to see now that this has become a topic of interest. It'll be interesting to see kind of how it all unfolds. But I think at this point, if you're a patient listening and you are, you've read about this, hopefully this has given you a little bit more insight on what graphene oxide is and why it's used in the anesthetics and where we actually are on the research, because I think you read all the stuff online and it scares the crap out of you. And a lot of times, like I said before, you might choose to not do something that actually could maybe be more harmful. So I think it's important that we are all informed and we can all make, good decisions for our health. But I think we also have to make sure we have pros and cons. And it sounds like there's some good research that is going to be coming out more on graphene oxide and anesthetics. So thank you, Teresa, for being part of that.
Oh, thank you for having me.
Awesome. All right. Well, of course, we would love to hear from you. So if you have any additional questions, feel free to reach out to us. Again, we're Green City Dental or Orthodontics. And Teresa, what is your dental office? You said you were in Houston. If people are listening and they're around you, where can they find you?
I'm in Spring, Texas. And the office name is Holistic Dental Associates. So it's holisticdentalassociates.com.
Okay, awesome. And do you have social? How do people get a hold of you?
On Facebook, I know that there's Facebook. I think we have Instagram and TikTok, but don't ask me much. I'm not a social media person. So the most I have is my Facebook. And if people want to get in contact with us, they can just call the office. It's 281-655-9175, or they can email us at info@holisticdentalassociates.com.
Awesome. Ladies, thank you so much for being here. Again, Dr. Teresa Scott, she is in Spring, Texas. So if you want to learn more about biological dentistry, holistic dentistry, and go to a doctor who really is on top of it all, I would highly recommend her practice. Her practice is called Holistic Dental Associates, and again, they're in Spring, Texas. And Isabel, of course, everyone probably knows her. She's from Green City Dental. She is one of the doctors that we have on board at our clinic, and we are located in Edmonds, Washington. Please make sure that you subscribe, and we would love for you to follow us on social media. We're on Facebook, we're on Twitter, we're on Instagram, we're on TikTok, Green City Dental, and make sure you follow along to Orthodontics as well, where we talk more about facial development, snoring, sleep apnea, breathing, and TMJ issues. So thanks everyone, and we'll catch you on the next episode. Remember, your mouth matters.